Am I ready to inject a patient? How will the patient feel? Will they be in pain? Or actually, do I qualify to do this procedure? That's the question. So, Assalamualaikum warahmatullahi wabarakatuh and a very good morning to judges, friends and audience. I'm Syahirah Binti Ahmad and along with me today is my partner, Syahirah Binti Nazmi. We are going to present on our research title, Perceived Clinical Competency Level of Students and Patient Satisfaction of Inferior Alveolar Nerve Block performed by dental undergraduates. Stepping into clinical years, we are eager to do and practice every single thing, every single knowledge that we have learned. But at times, nerve get to us. Most especially during this pandemic and lockdown, we have a very limited preclinical training before start to treat our patients, human beings. So here in our study, it was conducted to unravel an innovative clinical simulator prior to students performing local anesthesia on their patient. And our aim here is that we want to construct and validate a self-reflective questionnaire regarding the student's perceived competency level in performing inferior alveolar nerve block and also to assess the patient's satisfaction in receiving the inferior alveolar nerve block performed by the dental students. Result obtained from our study, it signifies that with the aid of local anesthesia simulator kit, also known as LAS, it is more effective in students' training of local anesthesia. This further reflected in their first time performing IANB based on the patient's feedback in the UITM Satisfaction Dental Local Anesthesia Scale, also known as USDLS. Here in our study, it consists of 40 third-year dental undergraduates and 40 patients. Then, they were randomly assigned into two groups, either interventional or control group, and each group consists of 20 participants. This cross-sectional study was conducted at Faculty of Dentistry UiTM Sungai Buloh, and along this study, two survey questionnaires specifically for the students and for the patient were used as a method of data collection, which each questionnaire consists of 4 questions of demographic characteristic and 20 questions of 5 Likert scale statement.
Thank you, Syahirah. Now I'm taking over this presentation. Upon questionnaire construction, which is phase 1 of our research, both questionnaires had undergone similar steps. Our first questionnaire, which is questionnaire A, targets the student's perceived clinical competency in performing inferior alveolar nerve block with major domains touching the perceived confidence, knowledge, and also attitude to perform the task. Questionnaire B, which is the USDLAS UITM Satisfaction of Dental Local Anesthesia Scale, was drafted based on the American Customer Satisfaction Index model and also Iowa Satisfaction with Anesthesia Scale. We had illustrated this flowchart of our research activities in phase 1 and phase 2 for both questionnaires. I will first explain on questionnaire A. Questionnaire A had undergone content validation by 8 oromaxillofacial surgeons, followed by 1 neurosurgeon, 2 health informatic experts, and also 1 biostatistician. Questionnaire A was then amended according to the experts' feedback and used in phase validation by 82 first-year dental students, sessions 2019-2020. Results obtained from the phase validation were used to improve questionnaire A so that it will be on a suitable level for subjects to answer in phase 2 of our research. A pilot study was conducted among 73 third-year dental students, session 2019-2020. The validated questionnaire A was then used in phase 2 of our research. In our actual study, the study population comprises of 40 third-year dental students, which were then divided into 2 groups, interventional and control group via convenience sampling. Then, we distributed the questionnaires within both groups before and after they performed their first inferior alveolar nerve block. Construction of questionnaire B followed similar steps as per questionnaire A. However, phase validation was done by 40 third-year dental students, session 2020-2021. construct validation will be performed in the future study which will be conducted in May. Now, for the results of our research. As you can see here, the first graph on the left shows that students in the interventional group showed a higher overall positive feedback after being introduced to the local anesthesia simulation kit. The graph on the right shows the patient's satisfaction and feedback towards the inferior alveolar nerve block received were positive. Cronbach's alpha coefficient were used to analyze the internal consistencies for both questionnaires. In regards for our discussion, we believe that the validation of questionnaire A will provide a reliable measuring tool to gauge awareness of preparedness and perceived confidence of dental undergraduates in performing regional anesthesia, namely inferior alveolar nerve block. For the USD-LAS questionnaire, domains pertaining patients' perception towards the operator and also their satisfaction towards the inferior alveolar nerve block received were positive throughout the study. We hope that USD-LAS questionnaire will be further validated in future studies as patients' satisfaction and feedback greatly impacts a student's confidence and performance. Hence, results obtained from this research signifies that local anesthesia simulation kit is more effective in students performing local anesthesia. Thank you.